Managing your health is a numbers game, and Dr. Gregory Green has joined us in the UH Broadcast Center to count off the numbers that you need to know. Dr. Green is an internal medicine specialist at University Hospitals. So let's talk about these numbers. What kind of numbers are we talking about?
So the big things we look at are your blood pressure, your blood glucose, your cholesterol numbers, and your BMI. Those are really the big four we like to focus on because they all relate to diseases that are potentially treatable and even preventable if caught early.
Okay, well let's talk about the first one on your list, blood pressure.
Sure. So when we look at blood pressure, we look at two different numbers. You have your systolic, which is your top number, and that measures the pressure in your blood vessels when your heart is actively pumping. The bottom number, the diastolic, which is the lower number, that tells us what the pressure is in your blood vessels when your heart is relaxed. In typical everyday Americans, the goal we're shooting for is 140/90 when it comes to blood pressure. You know, if you have kidney disease, if you're a diabetic, we tend to aim on the lower end of 140/90, slightly below that. If you're a little bit over, you know, the age of 60, 65, we loosen the restrictions on blood pressure for you.
Okay, so what's the dangers if the numbers are too high?
Heart disease, stroke. A lot of times we can see long-standing blood pressure causing thickening of the blood vessels of the heart, and it can lead to neurological problems too, like vascular dementia if left untreated.
Okay, so an important number.
Very important.
Second number on your list is blood glucose. Now that talks about whether you're pre-diabetic or have diabetes now, right?
Exactly, exactly. So basically we break it down into three different categories. If your blood glucose is under 100, you're typically in the safe zone. No real concern for diabetes. 100 to 125, we tend to be a little more cognizant of, you know, your blood sugars and your overall health. We call that pre-diabetes. Over 125, 2 times in a row, technically will qualify you for a diagnosis of type 2 diabetes.
Okay, again, an important number. Next is cholesterol.
Cholesterol is a very, very important number. You know, 1 out of every 3 Americans will pass from heart disease in the United States. So cholesterol we love to stay on top of. Back in 2013, the American College of Cardiology, they released an algorithm for us to follow that gives us your ASCVD risk score. And essentially what we do is we take your LDL, your bad cholesterol, as well as your HDL, your good cholesterol, and we put that into an algorithm. Also looking at diabetes history, high blood pressure history, history of a previous event, and that tells us your 10-year risk factor for having some sort of coronary event or a stroke.
All right, we've got to keep track of that. Finally, measuring if we're at a healthy weight.
2 big things we look at here are your BMI, or your body mass index, and then your waist circumference. BMI is really used as a screening tool. It's not a diagnostic test. If you're over a certain number, we think about whether you're overweight or obese and address those issues accordingly. And then waist circumference, you know, for females, we generally like under 35 inches, males under 40 inches.
Okay, so what if overall our numbers just don't add up right?
That's where you have the conversation with your physician, and we kind of tailor your individual needs to the individual patient.
Okay, so look at the numbers and make sure that you're doing the right thing by seeing your doctor.
Exactly.
All right,
Exactly.
Great advice. How can you stay healthy? Dr. Green just gave you the lowdown, keeping your numbers down low. Need help? Use the information that's coming up next. My thanks to Dr. Green for joining us today.
Thank you.
Learn more by calling the Center for Lifelong Health at University Hospitals at 1-844-312-LIFE. That's 5433. Or visit their website, www.uhhospitals.org/lifelonghealth.